We believe the bonding or attachment between mother and child should start immediately after birth. So as long as your baby doesn't require additional support, the caregiver will place her on your chest so you can see and touch her. There's no rush at this point, so your caregiver may not clamp or cut your umbilical cord right away. Instead, your nurse will clean your baby and do preliminary checks while the two of you remain together, skin to skin. Identity bracelets will be placed on both of your baby's legs. You and your support person will be given matching bracelets. After you've had your baby, you may have some mild contractions. This is perfectly normal, as the placenta, the organ that's feeding your baby through the umbilical cord, still needs to be expelled. This usually happens within 20 to 30 minutes after birth. If you're able, you'll be encouraged to breastfeed your baby within an hour of birth. But you should know that all feeding choices will be fully supported by our staff, and you'll receive all the information you need to feed your baby confidently and independently. The first day after you've given birth is a time to rest, to bond, and to start reviewing the basics of caring for your family's new addition. In addition to helping you with feeding, your nurse will also talk to you about what to expect when you take your baby home, and what's normal, both for baby and for you and your body as you continue to recover. Public health nursing services are offered to every new mother in Manitoba. A public health nurse will provide you with much more extensive information on newborn care, feeding, your recovery, and the services that are available in your community at home. It's good for you and your baby to spend as much time together as possible at the beginning, so she'll be rooming in with you continuously while you're at the hospital. This is where having your partner or a support person with you is so helpful. After the excitement of the birth wears off, you're going to want to rest, which means it's best to keep visitors to a minimum. There's no nursery in this area of the hospital, partly because we don't want to interrupt the process of attachment, but also because it's safer. The fewer people who handle a newborn, the lower the chance that she'll be exposed to illness. That means it'll be up to your support person to look after the baby while you're asleep, because a newborn baby should never be left alone. But don't worry. If you're by yourself, your nurse will make arrangements to look after the baby when you need a break. Note that all staff who have access to your baby must be wearing proper identification. Giving birth is natural, something your body is designed to do. That means recovery afterwards is just another part of the process. Even so, you may be surprised at how soon you feel ready to go home. Many women who've had a normal vaginal birth can leave the hospital a day after having their baby. Most are home within 2 days. In Manitoba, all children must be transported in an approved car seat. You'll be shown how to use a car seat properly before you're discharged.